Welcome, welcome all of you in this 9th class. So we will begin with the gratitude prayers. वह शक्ति हमें दो दयान दे, कर्तव्य मार्ग पर डट जाओ, पर सेवा पर उपकार में हम निज जीवन सफल बना जाओ। दुखी निबलो विकलो के सेवक बन संताप हरे, जो है बिछुड़े भूले भटके, उनको तारे खुद तर जावे। छल द्वेष दंभ पाखंड झूठ, अन्याय से निशिदिन दूर, जीवन हो शुद्ध सरल अपना, शुचि प्रेम सुधारस बरसावे। निज मर्यादा का प्रभु ध्यान रहे अभिमान रहे, जिस देव भूमि में जन्म लिया, बलिदान उसी पर हो जाए। हमें दो दया निधे, कर्तव्य मार्ग पर डट जाए। हमें दो दया निधे, कर्तव्य मार्ग पर डट जाए। Okay, we offer our respect, gratitude to Inka sir and everyone sir, all teams of Sanstha. So today we will begin with our session by this treatise for chapter number 10, liver meridian. All of you are having book treatise for. So see this location of liver meridian. It is same as in TCM. Now number of points, there are 17 points in this according to EAV, 14 points in TCM, and here 3 new points according to Dr. Voll. So below they have actually written that following 4 new points are discovered, but it is 3 only. It should be 3. This liver 2B is not the point here for portal vein. They have mentioned here, but it is not shown in the diagram anywhere. Or if we will consider these 4 points, then it becomes 18. So I think this is a printing mistake. 4 new points. Liver 2B is not there even in diagram. Okay. So liver 1A is a CMP liver. It's a control measurement point for liver 1A. You can see in diagram page number 125, liver 1A. It is the first phalange, and the below convexity. If you will use this point, liver 1A, at least 3-4 hours a day, every day, tonification of this, then your liver will be working very nicely. Because do you know about the liver's function? According to BHB, or physiology of liver, or it's a chemical factory actually, but we will see its function according to acupuncture. See, acupuncture physiology of liver. It is very useful organ Even it is said that corporeal soul, which is present in the liver, corporeal soul. So, if liver is properly working or your liver is healthy, then your all organs in all the body, all over the body are very healthy. Because what is the function in whole life? We are eating something in the morning, noon time, evening, or two times, or one time. Somebody, whatever we are eating, whatever we are drinking, it becomes blood with the help of food. It is converted into the food energy or blood with the help of spleen, and by this from stomach, small intestine, and spleen, all three organs, this porta hepatic circulation, means portal veins, gives this whole nutritious blood. It supplies to it sends the blood to liver, and liver ultimately takes its all the proper ingredients, nutrients, and separates all the chemicals and converts them into the useful form, and ultimately it filters the blood, and then it supplies the blood to the heart, sends the blood towards the heart. So as soon as which is the sense organ related to liver? It's the eyes. So as soon as we sleep in the night time, when our eyes closed and we sleep, we go into deep sleep, then all the blood from all the body parts slowly goes into the liver. This circulation is continuously going on, but for filtration, for detoxification, for purification of blood, so whole body parts blood slowly goes into the liver. Liver detoxifies that blood, and its work is going on. We know the organ clock time 11 to 1 and 1 to 3. 1 to 3 is timing of liver, and 11 to 1 is gallbladder. So during those 4 hours, this work is going on very silently and very nicely into the liver, and it is done within those 4 hours, and it is it keeps going on during daytime also, 24 hours, but during that 4 hours, its maximum work is almost 80-90% work of liver and gallbladder is finished during those 4 hours. And as soon as in the morning you open your eyes, the liver starts giving blood slowly to all the organs. First of all to the eyes, then your vision gets clear as soon as you wake up early in the morning. Then it gives the blood slowly to the eyes, then all the brain structure, so that you can recognize what you are seeing. Then all the body parts, slowly your hands are moving, legs are moving, then all body parts. Then you are waking, you are getting up from the bed. These things are happening because liver slowly gives the blood to all the parts. And then that's why it is saying that it is said that liver contains corporeal soul. So this soul, during the night hours when you are in the sleeping state, this soul is completely accumulated in liver only. Soul means through blood, that energy goes to the different parts of the body. That's why that liver keeps that soul into it, corporeal soul, completely in unconscious manner. It sleeps and it does its functions in the liver. And whole body parts, all the body parts are just like dead. There is no energy while you go into the deep sleep. And in the morning, that liver gives all the parts that hold blood supply. That's why the corporeal soul goes to the blood, through the blood, to all the body parts. And that's why we wake up and then we start our work, daily routine. So this is the main function. All the chemical separation, all the nutrients which are assimilated through the digestive tract, it converts into the usable form, its energy form, and then it supplies to our body parts. That is the function of liver. So it's very important meridian. It gives the corporeal soul all over the body. So we will see how important it is. Now we can see the second point. The EAV following 10 points are redefined. So this is just a see. Liver 1 is central venous system of liver, venous system, then lobular system, then perivascular system, ankle joint. These are different points because each and every body part it covers CNP, blood, veins of lower extremities, the knee joint, parasamentalis, gonad, sympathetic nerve. Every part of body it goes. Third point is liver 1A is the control measurement point, and the functionality, it is useful for functionality and means functions and different diseases of the liver. Now, treatment of the liver disease. To improve the flow of biles, treat liver 3, initial bile ducts. It is very important point, liver 3. It's a source point. You have to remember source point. This will excrete waste and toxic material. The initial bile duct is often blocked by metals. So metal toxins and all the are cleared up with this. The ladies with copper T inserted may develop blockage of initial bile duct. Yes, because of the copper, it's metal. Those who cook in aluminum utensils, their liver 3 right may be blocked. Those who consume silver or aluminum foils on sweets, their liver 3 right may be blocked. So energy is blocked. And for even in any condition of illness or more in female diseases, it is very important, this liver, because of the stagnation of the blood, stagnation of the energy, liver key stagnation and liver blood stagnation. These are the important aspects as per the liver is concerned. And because of that, there are so many disorders in ladies, irregular menstruations, then less blood flow, then PCOD, so many things. Then left liver lobe may be blocked by lead, gold, mercury, allergies of liver, treat liver 3, perivascular system. See, sedate at the time of attack of allergy. This liver 3 should be sedated at the time of allergy and tone in the intervening in allergies. That is a clue. Now we will come to the page number 124. We will see the different functions of different points. Liver 1 is empty central venous system of the liver. See, it is the portal hypertension. It is useful in portal hypertension, right heart failure due to insufficiency, treat liver 1. You might be knowing this portal hypertension. The portal veins are directly the connection from the stomach and this small intestine. It gets the blood, which is nutritious blood, and which goes directly into the hepatic circulation, portohepatic. It's a portal. So if the right heart is failed, then this portal hypertension is the cause of that. Then water-soluble waste, hemorrhoids due to portal hypertension of the liver. Yet, yes, it is also causing hemorrhoids. So this is the treatment protocol, liver 1, K5 and K6. Because anus is the opening. So the openings means the anus and the urethral opening. The sphincters, these are under the control of kidney. So K5 and K6 are the main points. Now spatial or central venous system of the liver may be damaged by, so the different these things have reasons have given. Okay, sedate or tone, in which okay these points na? This is hypertension na? Portal hypertension due to right head, and even hemorrhoids is the excess of blood which is flowing through this, so it should be sedate. Correct. Now generally you can see most of the points in liver meridian should be sedated, because every day we are eating something or other thing, and eating means we are putting something inside our body, outside things we are putting in our body. So it is in excess. Liver is always in excess, kidney is always in a deficient state, because kidneys energy is completely used in everyday day-to-day life, every activity. Kidneys energy is very important. It's usable continuously, it's in use, so it's always in deficient state. It means most of the time, 90-95% of the time. And liver is always in excess state. If those persons who are properly taking their diet and following the 16 hours 14 hours fasting every day, then their liver may be sometimes excess. Otherwise liver is deficient, sorry. Otherwise it is in excess always. So these are some conditions they have mentioned here. Now you can come to the third point. This congestion of the central veins may ultimately cause a slow destruction of the liver cells, then an increase in the connective tissue in the walls of the central and collecting veins. Then ultimately it may cause congestive atrophy of liver and so-called nutmeg liver. It is called as a nutmeg liver. The liver gets atrophied. You can see on the page number 126. In this case, energy on all the 3 points, that is liver 1, liver 3, and heart 9 reduces. So tonification of these points gives the good result. In which cases, where the cells of the liver are destroyed and the liver gets atrophied, it becomes nutmeg liver. It becomes small, so it's a deficiency. That's why it's a tonification of this all the points, liver 1, 3, and H9. Okay. Then for diagnosis and treatment of blood vessels of liver, use these points. So can diagnose vascular disease of liver here, a deficiency at liver 1 and K6, or hemorrhoids. It has already mentioned earlier. Now liver 1A, this is CMP of liver. For balancing liver functioning, treat liver 1A and liver 1B, lymph of the liver. Okay. For function, balancing of the function of the liver 1A and liver 1B. Then liver 1B is the serous peritoneal membrane of the liver. Then liver 2, MP liver lobuli system, including cells and lobules of the liver. Okay, it's an inside system of the liver. So toxic damage may happen because of the bacterial and viral infection. This is best point for the treatment of infection. Then this is good point for treating the headache also. Yes, for headache it is very good point. I have applied practically to so many patients. Any type of headache, whether it is a frontal headache, vertical headache, temporal headache, especially for the temporal, frontal, and vertex headache. It is very important point. Liver 2, sedation. Always sedate. Headache is the excess condition. So sedate this liver 2. Within 10 minutes, headache will go. Then deficiency on liver 2 indicates an elementary fat liver. Okay, also check fat liver. A deficiency on liver 2 is only one side, signifies recovery of liver at inflammation caused by infections. Okay, in infections it should be used. Okay, and it is given there in the next page 127. Whenever you get infection, whether viral or bacterial, is cured with the help of liver 2 tonification. All types of infection are cured. Where infection is there, we have to tone this liver 2. Otherwise, in case of headache, we have to sedate this liver 2. Okay. now liver 2A. It is MP for interlobular bile ducts. Okay, bile ducts and inside the liver where the bile forms and bile goes into the bile duct. Liver 2B, it's MP for portal vein. Liver 3, MP perivascular and periportal system of liver. Okay, you can see in this diagnosed bile condition at liver 3 and gallbladder points. Then a deficiency at liver 3 indicates the prestige of liver cirrhosis, pre-stage of liver cirrhosis. Then deficiency at liver 3 and K5, so the beginning of the liver cirrhosis. Means these are the different conditions where liver cirrhosis happens. A deficiency on all liver point, liver 1, 2, 3 indicates the progressive liver cirrhosis. What is meant by liver cirrhosis? It is given now, chronic liver cirrhosis. You can read it out. So the last point is biliary liver cirrhosis. When liver cirrhosis starts, that time on liver 3 energy reduces, but by liver 3 tonification treatment, liver cirrhosis never harm you. So generally in the patients who are very habitual to take alcohol, alcohol causes more, those patients are more prone to the cirrhosis of liver. So you just suggest them to tonify their liver 3 point always, so that liver cirrhosis may not happen. Okay, then liver 4, you can see in the diagram, liver 4 is exactly in front of the medial malleolus. There is one tendon before, in between that tendon. Just like a liver 4 is just like a this, whatever Li5. Li5 is in the anatomical snub box. Here is that this is the thumb and this is one tendon. In between tendon, these two tendons, there is one snub box, that is Li5. Like that, below, if you will check just this in between medial malleolus and the tendon of the great toe, there is some deep depression is there. There is the exact point liver 4. So this is very good point actually. It has mentioned here, this is very good point for treatment of prostate. But I have seen this practical application of this point in this stroke patients. When stroke paralysis is beginning of the paralysis, when stroke happens in somebody, if you recognize the symptoms of the patient, if he is telling my balance is going on, my hand or my foot is just I am not able to speak properly, or something like one side is going less energy is going down, and means we should recognize that this patient is suffering from stroke, maybe some ischemia or some blood clot, ischemia, or some bleeding disorder in the brain structures. Somewhere it happens. That's why his right or left side is going down. So paralytic, it's a pre-stage of paralysis. When it happens, and if you are seeing this patient is suffering from this condition, and if at the same time, if you will apply this liver 4, it's very important point. As soon as you apply this point, liver 4, I have seen by acupuncture, I put the needle actually there. So patient gets activated, its energy is activated, and we can save that patient from suffering of his suffering, like from stroke. It can be preventive point for the stroke patient in cases of paralysis. Even after paralysis, we can use this for liver 4. It's very important point. Then liver 5 is MP for blood. See liver 5's location. It's almost 5 kun above the medial malleolus, just along the, yeah, it should be toned. But at the same time, when stroke, when stroke is happened completely and patient has come to the treatment, it should be toned. Otherwise, it should be sedated. At the same time, when you are seeing the patient is suffering from that condition, the stroke is just beginning of the stroke. That time you should sedate that. But later, when the patient comes to you after his stroke, means he admitted to some hospital and then he come to the further treatment after discharge, then you have to use this as a tonification. Liver 5 is NP for blood. So you can see the location. It's a 5 cone from the medial malleolus along the ball drop tibia. So this liver 5 is NP for blood because there are 2 points, this PN6, SP6 and K7. K7 is just 3 kun above, 2 kun above, and SP6 is 3 kun above, and this is 5 kun above. They are just neighbor to each other. So that's why it is called as the NP for blood. Now come to the page number 130, liver 7. It is the MP veins of lower extremities. Now this is very important point. See, you can see today I have applied liver 7 on both the legs. Liver 7. This is thrombosis in legs here. So this is actually not, I'm not having thrombosis, but I was having pain in my left leg, right from backside knee up to the heel on the backside. Severe pain since morning. And as soon as I applied these 2 points from morning, after 1 or 2 hours, I got complete relief. This is liver 7. I applied this today only. So this is also very important point because somewhere energy is stuck up. As I am sitting here for at least for 7 to 8 hours in my clinic. And for this lecture again 1.5 hours. So today I will sit here for 9 to 10 hours in my clinic. So my legs, both the legs are below, below chair, and I have to stand for treating patients here. As tables are there, so beds are there, so I have to stand and treat the patients. So daily 8 hours standing position. Then because of that, sometimes energy gets stagnated in between. So it's a venous energy, venous blood. So that's why I applied this MP7 for veins of lower extremities, liver 7. Now liver 8, you might be knowing this. Where is the position of liver 8? According to TCM, it's just a medial end of the popliteal crease. Just back side of the knee is popliteal fossa. So this is popliteal crease. So that's why it is the first can be knee joint, medial side of the knee pain should be treated with this liver 8. Liver is very important point. It's a tonification point actually of liver. So other two points to treat the liver are ST35. It's the completely opposite to this liver 8, and UB54 is the back side of the knee joint. So these are the 3 points. 3-point protocol to treat any type of pain in the knee joint. ST35, UB54, and liver 8. Okay. Then liver 10 is the bursa mentalis posterior wall. Then liver 11 is MP for gonads. Again, we have seen that. Liver 11 is just, you can see the location of liver 11 on page number 132. It's just near to your pubic symphysis, genital organs. That's why it's MP for gonads. Also treat SP. We have seen SP11, PN11, and ST31. These are on the same axis, same line. ST31, 2 kun from the center, from the midline of the pubic symphysis. Then PN and SP is 4 kun, and this liver is just near below that. You can see that liver 11. It's almost inguinal region. Now liver 13 is alarm point for pancreas. Alarm point means, again, alarm points are two types: front shoe and back shoe, front move and back shoe. So this is front move point of the pancreas, liver 13, and liver 13 left side alarm point for spleen, right side pancreas. Now liver 14 is the lymphatic net of liver. In classical Chinese acupuncture, this is the alarm point of liver. Okay, alarm point of liver means this is a front move point of liver, liver 14. Now come to the page number 133. Here the special note about the liver. Liver secretes about 1 liter of bile per day. Every day it secretes 1 liter of bile. Its pigment is yellow brown. Liver produces bile salt from cholesterol. The surplus cholesterol is thus used by the healthy liver. Bile salts absorb fats, vitamin A, D, K. Bile salts activates digestion enzymes. Bile provides lubrication for the intestinal tract, and then only from our intestines, the food and all the substance goes very smoothly as it gives the lubrication. Then shortage of bile may cause constipation, because if bile is short, then your fatty, whatever you have eaten, the oily or fatty things will not be converted into fine fats, and they will not be digested properly. And because of that, the smoothness of intestinal tract becomes less, so it's dried up. That's why constipation happens. Okay, then a treatment on liver 3, initial bile duct, improves the bile flow and the excretion of toxic material, and waste starts. Then bile removes waste, toxics, all the things. Okay, right liver filters calcium, copper, radiation. These are the some elements. Left lobe of liver filters the lead, gold, mercury, cobalt, just high metals. Treat liver meridian points on the left foot. Okay, metal block the on the left side left foot and right side right. Metal blocks the initial value calcium, cholesterol from the gallstones. Cholesterol stones cannot be seen in the X-ray plates. Okay, this is just information. In this treatment for cholecystitis can treat shoulder pain also. So those who are having cholecystitis because of the gallstones, so for them there is a pain in the angle of the scapula, backside, shoulder pain and angle of the scapula. So treat liver 1B. Also treat cervical 3 and 4. Cervical 3, 4, and this liver 1B. It's very important protocol, because so many patients I have seen who are having the pain in the angle of the scapula or shoulder pain here. It's very important. Now you can see here the liver has a double blood supply, 20% from hepatic artery and 80% from portal vein, which drains venous blood from spleen, stomach, and small intestine. Right? It's the portal vein. Fat enters the liver from small intestine. Toxin and waste material enter the liver from spleen. For balancing the liver functioning, treat liver 1A, that is CMP, liver 1B, and liver 14, that is the again front shoe point. Right shoulder pain can be referred pain due to fatigue. Okay. Now this ends our liver meridian. You can see in the picture one at 132 page number. This liver meridian ends in the just 6th intercostal space, just below the nipple. Nipple line is mammary line, and there is the liver's location. We see this on the right side. So this is alarm point. No, you can use the these points on the BL meridian. You can use on BL meridian. we do not use body meridians here, na? Because in Sansthan what we are learning, you can have no problem if you know the exact location of the point. That will be more beneficial. At the same time, you can apply dual meridian, dual points, and at the same time main points on the body also. You can use that. Some patients are very nicely cooperating with my treatment. They are placing the big magnets, number 3 or number 4 magnets, on directly on the somewhere means on the body parts. If I will show them this is the exact location of this point, you can place your magnet. They are doing that, and that is very helpful. Yes, the patient's recovery will be very fast, but it requires little big number of the magnet. Okay, now we will go ahead and we will cover up this stomach meridian also. It's very vast, it's big one. So you can see on page number 135. Yeah. EAV and Chinese acupuncture, the location of stomach meridian from ST1 to ST10 is different, and we are not seeing these points at all from 1 to 10 because it's too much here and there it's going on. Actually, our meridian, the TCM, it starts from the below the eye. So ST1, then ST2, ST3, ST4, then it's going from here to here, then ST5, ST6, ST7, and ST8 is, but it's beginning from here. So it's on the face we are not taking these points. We can use these points on the hand. You will not see that point 1 to 10. Then the same from the 10 to 15, and then this meridian starts at Chinese meridian and goes to the root of nail on the lateral side of the second toe of foot. Number of points. There are 72 points according to Dr. Voll. So he has discovered almost 27 new points in this meridian, because in TCM there are 45 points in total. So 27 points are these 20 ST44D, 44C, celiac vessel. Now you can see these are this is ST44B is very important point. It's a CMP of stomach. Then whole digestive tracts, the lymph, the peritoneum, and all the celiac lymph nodes, jugular lymph nodes, everything is there. Now you can see on page number 136, 32 points are redefined. Again, these are 27 points and 32 points he has redefined. Some are MP, for some are SMP for some different joints or some different organs. This is specific ST45 on the right side, pylorus and body of the stomach. You have to know the structure of the stomach. Where is the cardiac end of the stomach? The stomach is, this is the fundus of the stomach. Then this is the pylorus of the stomach. Then the pyloric end of the stomach. So different parts of the stomach should be known. The 44 right side, pyloric antrum and fornix of the stomach, fornix and fundus below. Then ST43 right and left, right body of stomach, cardiac end of the stomach. Then ST42 upper portion of esophagus. The second MP for ankle joint, ST1 because its location is near to ankle. So it is given there, different. You can read it out. This. Wherever the location and nearest organ is there, that is the MP for that particular organ or particular gland. You can see on page number 137. ST11, 10, and 9. These are for thymus gland, thyroid gland, and parathyroid gland, because these are very situated very near to those organs here. So 9, 10, and 11. Now come to the page number 138. It is specially mentioned lens of eye, ST4. Even according to TCM, this 1, 2, 3, and 4. These 4 points are very useful in the eye disorders, any type of art or visual disturbances. Then again it's mentioned celiac plexus and gastric plexus. It is also called as the solar plexus. Then ST44B, CMP for stomach, best point to treat all the diseases of the stomach. Okay, come to this actual points on page number 139. ST45. Right side pylorus means lower gate. Here stomach connects with the duodenum. Okay, and left side corpus ventriculi, body of stomach. This is the sedation point. Here basic mucus generates which prevents from heartburn. This is sedation point. Check here and treat heartburn and reflux, esophageal reflux. And cause of this is mercury fillings. So somebody is feeling the mercury in the dental cavities. So in that patient, ST45R, this point maintains acid-base ratio in stomach. You can see its location, ST45. According to TCM, it's a corner of the nail of the second toe, lateral aspect, towards little toe. And here it's a first curvature, it's concave part of the bone, ST45. It's a very useful point to regulate the acid-base balance in the stomach. Whether you are suffering from hyperacidity, whether you are suffering from hypoacidity, indigestion, everything, this point is very important. Just apply ST45, your acidity will go within 15 minutes. This is the acid-base regulation, acid and alkali regulation. Then ST44D is lymph of the stomach. Then ST44C, this is SMP, right celiac plexus, left celiac plexus, gastric plexus. This supply is main autonomic nerve supply to the stomach. Then this is an autonomic innervation point, ST44C. You can see its the location, ST44C, CMP. So second phalanx. Treat stomach upsets and other problems. Always take celiac plexus when dealing with stomach upset and other problems. This is a sympathetic plexus, also called as a solar plexus. Okay. Now it is best for resetting solar plexus. Sometimes this ST41 said it. No, if it is a hyperacidity, it's depend on conditions. If it is hyperacidity, then it should be sedated. If it is indigestion, it should be toned. In the different situations. In the different conditions of digestion. But if, generally, we have to sedate in case of hyperacidity. Okay. Then come to the page number 141. ST44B CMP for stomach. Actually, CMP is 44C. Why he has mentioned. Okay. In diagram, they have mistakenly given that actually 44B is the CMP for stomach. Yes, but in diagram they have mentioned about 44C. Okay, it's a little printing mistake. Then ST44A, again serous peritoneum coating point. ST44 is the pyloric antrum. Then ST43A, right gastric pathway in the ascending section. This is the left gastric pathway in the ascending section. Laser curvature of stomach. Treat here for right side of stomach. 43 right, 43A right. Then for gastric ulcer, they have mentioned one nice protocol. 43 right, then 43A right, and SI4, small intestine's fourth point. It comes here in the body actually. Put on the Voll meridian, it will be here. So this is best treatment protocol for gastric ulcer. Then gastroduodenitis, again 43A right, SI4 right, and PN1A. Then ST43 right, body of stomach, cardia of stomach. Treat diaphragmatic hernia here. ST43 and UB17 for hiatus hernia. It is also called as a hiatus hernia. Diaphragmatic hernia. Then achalasia of the cardia means what? This is the term specially used where the food is not going because of the not proper relaxation of the cardiac muscles. Food is not going properly. That's why it is called as achalasia. Achalasia. Food does not reach stomach. Though there is no obstruction in pathway, it is due to failure of relaxing muscles. Treatable without surgery. Yeah. Without surgery, everything is treatable here at certain stages. If it is a chronic thing, and because here our science is when patient goes into the almost third stage, last stage, like that, that patient comes to us like that. So even though at that stage we can treat the patient, but patient should have patience in his mind because our treatment is very lengthy. If it is in a early stages, he used to come, then we can treat him, no problem. Yes, it is leading to hyperacidity. Achalasia, correct. So you can use 45 also, ST45 to treat the balance between acid and base. Okay, this is achalasia condition of the cardiac end of the stomach. The pathway is clear, but it is not relaxed properly. That's why food is not entering, not going by it. Now come to the page number 142. It is the best point for the treatment of hiccups. Continuous hiccups. Some patients are coming like this. Again, you have asked the same question. Tone or sedate the ST45. If it is hyperacidity, okay, in this condition, achalasia. Yeah, achalasia, it's again, it's not relaxing, it's excess. So you have to sedate this. In case of achalasia, you have to sedate this. But at the same time, if patient is giving you the symptom of hyperacidity along with this, then we have to sedate. If hyperacidity is not there, still we have to sedate because it's a achalasia, it's the contraction of the muscle is excessiveness, hyper. So we have to sedate. So that patient, the muscle will relax and the food will enter. For achalasia, we have to sedate. For even hyperacidity, we have to sedate. You can see here, tying a star magnet. Best point for the treatment of hiccups, tying a star magnet on original ST43, right? Cures the chronic and continuous hiccups. If somebody is having continuous hiccups, we have to treat this with ST43, right side. Deficiency of energy on ST43, right, indicates gastric ulcer also. If the ulcer is deep, then there will be deficiency of energy in pancreas also. Treat SI4 along with ST43 and SI4. Treatment point for upper horizontal portion. Come to next point, ST42A. You can see the locations here also. ST45, ST44 on page number 143. ST42. Yeah, on page number 140 it is in detail. Up to 41. So 42A. Okay. 42A. Lower portion of the esophagus. Treatment of the heartburn and reflux. Well, lower portion of esophagus. So heartburn and reflex will be treated here. Now come to the next point, ST42. Okay, ST42 is upper portion of the esophagus. Treat the blockage caused by swallowing oversized objects. Sometimes patient has to take the banana so that it goes any foreign object. In children, it happens. Yeah, marble or coin. Treat this point. Make patient to eat ripe banana. Will pass out to the anus. These are some tricks you have to use. Okay, then come to ST41A on the next page, 144. It's a mammary gland. Any disease of mammary gland, treat this point. ST41A. So this is mammary gland is upside of the body, and this point is completely on the leg below. But this is called as the distal analgesic point. Distal analgesic point or distal point. Distal to actual site of the disease or actual site where the problem is. So distal point is 41A. So for leg amputes, treat this. Okay, TW3 also treats mammary glands. We have already seen. ST41 second MP for ankle joint. You know, ST41 position, it's the center of ankle joint in the front side. You can see here. ST41, it's the front side exactly, the ankle joint. Now ST35 second MP for knee joint. You know, ST35 point is the midpoint of knee joint from the lateral aspect, both outer sides. ST35. We have already seen in liver 8. While treating medial side of the knee joint is liver 8, and the outer side lateral aspect is ST35. So this is MP for knee joint. ST33 is abdominal veins. ST33 is artery of the legs. Again, if anything happens to the arteries of the leg, especially heavy deficiency at this point denotes stenosis in the arteries of the legs. Treat this point. In the smokers, there is a lower extremities arteries are become stenosis happens. So this is very important. Treatment of smoker's leg when there is a vascular stenosis. Also problems also treat UB61 because this is the MP for lumbosacral spine. UB61. Now ST31A. Bursa mentalis. When organs of abdomen start sagging downwards due to the inactiveness of bonding, then treatment on this point restores the sagginess and establishes the organs at its place. Sagging of the organs from abdomen. So this is very important point. ST1A. Where is its location? It is almost from the hip to knee joint. It's a 2/3 below and 1/3 above on the thigh. There is a center of 2/3 below and 1/3 above. STA, ST31A. You can apply on VR. Okay. ST31. Now this is gonads. Gonads include ovaries and women and testes in men. Treatment point for both. Then also treat. We have seen for gonads. This is very near to that location. SP11, PN11, liver 11, and this ST31. Already seen while we have studied this. Being PN and liver. ST30, testicular or ovarian. Yeah, you can see in the diagram. This is very useful point practically in AVN. Do you know AVN? This is the disease called as the avascular necrosis. It is generally happens the less blood supply or the blood supply gets impacted to the head of the femur. So there is a neck of the femur in the thigh. There is a neck of the femur and head of the femur, and that head fixes to the hip joint. Exactly. So this because of the impacted blood supply, this necrosis happens of the head of the femur or neck of the femur. So it breaks down. This is very painful condition, and nowadays I have seen a lot of patients of AVN also. So it's very best point. This one, ST31 and also ST30 for hip joint for that AVN condition. You can look in the diagram also on page number 147. This is the neck of the femur is shown. 31 point is just base of the neck, and 30A or 30, these are the different points. 30 is also important for this AVN. Now ST25, all of you must know this. ST25 is alarm point of large intestine. But it is very important for the gases problems, hyperacidity, indigestion, constipation, any problem. ST25. It's just 2 kun on the lateral aspect of the umbilicus from the midline. And it is also the front move point of large intestine. Now ST22, right, the superior upper gastric plexus of sympathetic nerve and all that. It's just ST22 right side. Come to the page number 148. Treatment of stomach by balancing the autonomic steering. This happens with the help of ST22, right, upper gastric plexus, then GB43, ST44C. This is hepatic plexus, celiac plexus. This is very important two flexes, celiac and hepatic plexus, for whole digestive tracts, digestive system. Okay. Then come to the next point, ST21, abdominal portion of the vagus nerve. Treatment on this point pushes the obstructed food forward. ST21, because of its location. 21 is just near to the just 4 kun above the umbilicus. So that is the special area near to stomach and esophagus. Now ST20, posterior portion of the gastric plexus of the vagus nerve, anterior portion of the gastric plexus of the vagus nerve. Okay. Then ST19, phrenic plexus. Okay. Diaphragm, related to diaphragm. Come to the next page, 150. This is pulmonary plexus of the vagus nerve, ST18. Deviation and obstruction is functionality of lungs. Treat this point. Okay. In the functionality of lung, if there is obstruction or deviation, so it innervates to the bronchi and lungs and pericardium. This is the vagus nerve, pulmonary plexus. Vagus nerve is supplying to both. It's a pneumogastric. Pneumo means related to pulmonary things. This lungs and gastric means to the digestive system. Pneumogastric. Then ST17. ST17 is mammary gland. Yeah, you must have to know this. ST17 is the center of the nipple. Center of the nipple, mammary gland center. ST17. So it's a MP for mammary gland. ST16, thoracic portion of vagus nerve. We have used these points also for ST17 for sagging of the breast in the older ages, like somebody may get at the age of 30 or 35 or 40, sagging of the breast. So to tonify the breast, use this ST17. It's a very good point. Then ST16 for the vagus nerve again. And vagus nerve, this is the upper back thoracic portion. Then ST15 is superior plexus of the vagus nerve. Deviation obstruction in the function of the esophagus. It's going down the vagus nerve from when it comes. It's a 10th cranial nerve, so it's going down from this area. That's why these are the plexuses which supplies the particular organ on that path. Now ST14, lower portion of esophagus. Okay. Here you can treat reflux esophagitis. Also treat ST42 and ST15 along with ST14. Now ST13 is for upper portion of esophagus. Again, for the contraction, like in vomiting, where the energies contraction of the energies happen. In that condition, you can use this, or reflux esophagitis. diagnosed achalasia, disorder of the transport of the fluid, ST 13, 14, 15, 42A and 42 and 60. Okay. Now come to the next one, ST 12. It's the bronchomediastinal lymph. Again, all the bronchopulmonary lymph nodes, bronchial, tracheal. ST 12A, sternal, parasternal, mediastinal lymph nodes. ST 12, carotid sinus. See, this carotid sinus is here. So, communal carotid artery, common carotid artery is here. We can feel the these bits here, pulse here, carotid wave. This is autonomic steering of thyroid, parathyroid, and thymus. This is also a very important point. If the parathyroid, thyroid, and thymus is not properly working, we have to use this ST12. Then 11 is for thymus gland. You can see this diagram on page number 154. 11 point, ST11. It's the medial aspect of the clavicle, on above the medial head of clavicle. There is that point, ST11. You can use Voll for any function derangement of thyroid, parathyroid, and thymus. Okay. You can come to page number 153. It is mentioned the weakness of the suspensor ligament of organs in ligament insufficiency of spine, joint disorders, chronic focal infections, and to increase the immunity in the children below 14 years. Till this point. Which one? ST11, because it's the MP for thymus gland. And thymus is very important to increase the immunity in the children. Now we will not go in that much deeper from ST10 up to ST1. You can just read it. It's a little complicated locations here, but you can read out and apply on the here on the Voll value. For high BP, ST10A, then ST10 thyroid gland, ST9 parathyroid gland, then ST8B, page number 155. Yeah, this is also very important point. ST8A. It is very important point for production of saliva. Salivation. Somebody, I have seen some patients who do not produce their saliva. Their salivary glands are very inactive. So that's why those patients are not able to eat. There is a less appetite because of the dryness in the mouth. So less appetite. When they used to eat, there is a not mixing of saliva. So that's why they have to make more efforts to swallow the food, and it causes their weight loss also. I have seen some patients, weight loss is happening because of this less salivation. Even weak patients who are not digesting their food properly, not taking much food, appetite is very less, and very less weight is less. In weak patients, lean, thin, emaciated, prostrated, debilitated patients, you can use this point. It increases the saliva production, the salivary gland, and because of that saliva production, the appetite is much. It increased appetite, and the digestion happens because of the mixing of the saliva. So this is very important one. ST8A. You can see its this is actual position on the 157 page number 8A, but you can apply on the Voll method. 8 points. ST8. It should be between actual 8 and just near to 9, like 8A. But even you can use 8. The existence of salivolithiasis. Then saliva is secreted from 3 pairs of glands. Parotid gland secretes 20% saliva. For that, main point is ST3. Other point is ST6 and 7. And submandibular gland secretes 75% of saliva. For that, we have to use ST8A and ST8-3. These 2 points. And the sublingual gland which secretes the 5% of saliva. For that, we have to treat CV23A and 23B. Medulla oblongata controls parotid glands. All the parotid glands are under control of the medulla oblongata, which is situated in the brain. So for that, we have to treat UB10, which is medulla oblongata is here. So UB10 is near to that. Hypoglossus nerve gland. For hypoglossus nerve, we have to treat ST5A and ST10A. And for inflammation of salivary glands, we have to use this. These are the MP for submandibular, sublingual, parotid, auxiliary glands. And lymph drain points. But you have to remember this 8A, ST8A. Very important. You can apply on original points also here. Just near to the teeth here. Because of glands are here, salivary glands. Here you can feel salivary glands. And inside here, parotid gland. So better you can apply on the dual meridian. Now 8-3, then 8-2, so 8-1, 8, 7. Again, for the lower jaw, lower mandibular portion, for lower 5 to 8 teeth. For toothache, yeah, it's very important again. For toothache, we have to use, I have used ST 45 and 44, 45 sometimes, 44, 45, 43. Any type of pain in the teeth, toothache, we have to use this. It comes here, stomach, 43. It's a wonderful point. Just to set at this point, your toothache will go. I have seen the patient's pain, tooth pain, vanishes within few seconds also. Means even within 1 minute, patient tells me, "Oh, what you did, doctor? Here, I have taken already 2-3 painkillers. Still, my pain is not controlled with the help of painkillers. Whole night I was in a agony, complete in a pain, toothache. And what you did here, just my pain is decreasing like anything. It happens sometimes." ST 43, 44 and 45. These are very important point for toothache. Then ST4, come to the page number 159. Parotid gland, ST3, then ST2, MP for lower jaw, gas. Again, they have given a regular protocol of gastric ulcer. Same thing. These all points should be sedated in the case of gastric ulcer. Okay. ST43 right, then ST4 right, ST45 right, ST44C, B, A, and 44, and P and 1A. All points should be sedated in case of gastric ulcer. So in this way, this ends our stomach meridian. Now we will go ahead and we'll cover today itself the gallbladder meridian. Is also a big one. We have to finish it. Okay, come to the page number 160. Gallbladder meridian. In EAV, Chinese Acupuncture, the location of gallbladder meridian is same. This meridian starts from the outer corner of the eye here and goes to the root of the nail on the lateral side of the fourth toe in front. Good. Number of points, 56 points according to Dr. Voll. And in TCM, there are 44 points, we know. So newly discovered points are 12 in number. We can see the GB43B is the CMP of gallbladder. Anything happens to the gallbladder, we have to use this CMP gallbladder. GB43B. Now 25 points are redefined. In that you can see this gallbladder meridian, we have to know its course, main course according to TCM is mainly on the brain, mainly on the scalp. Once it starts from here, then it goes backwards. This gallbladder 8, 9, 10. Then again it comes from the back to front. 11, 12, 13, 14, 15. Then again it goes back. 17, 18, 19, 20. So from 1 to almost 20, 21 points are on the brain. Out of TCM, out of 44 points, there are 20 points on the scalp area on the brain. So all kinds of brain diseases, all brain structures, brain diseases, all the related to brain, disease related illnesses, or any symptom related to brain, or sense organ, or muscular things. This is very important. Gallbladder meridian. You can see 25 points are redefined. You can see there from GB1 PSMP for posterior eye, GB3 trigeminal nerve, GB4 thalamus. It's a part of brain. GB7 diencephalon, GB8 tuber cinerea, GB9 SMP mesencephalon, then GB10 nuclear rubor, then 11 sleep and awake center in the mesencephalon, then GB12 posterior hypophysis, pituitary glands posterior part, then GB14 lateral geniculate body. It's a structure inside the brain. GB16 somnic center, then GB17 formation reticularis, here formation reticularis inside the brain. GB18 superior branch of the colliculi, then GB19 cerebral peduncle, GB20 SMP sympathetic nerve, GB21 anterior lobe of the pituitary. You can see all the 20 points are related to brain only. So it's very important meridian related to brain disorders. And some points are related to bile ducts and gallbladder itself. Okay, come to the page number 162. In gallbladder meridian, following control measurement points are there. GB43B is the CMP. Yes, main point. Then in the 6th point, it has given this in gallbladder following 7 summation measurement points are there. SMP for lateral section of the ankle joint, where the course is going. The course actual according to TCM or EAV. The course of the meridian goes on that pathway. These are the SMPs. Ready to do that nearby. Now the last point, discovery of points for midbrain, interbrain, etc. on gallbladder meridian by Dr. Voll made the treatment of brain easy. Okay. Come to page number 163, gallbladder meridian. GB44. So this is very useful point for gallbladder stones, GB stones. Common bile duct, this is duct takes bile to duodenum, then left common hepatic duct, and this bile comes directly from liver. Yes. GB43D, you can see the locations on the page number 164. 44, 43D. Then 43C, hepatic plexus, is on the right side. Okay. And the splenic flexure on the left side. Now 43B, it's a CMP, so gallbladder and bile duct. 43B. Correct. Now 43A, peritoneum serous-coating. Then 43 left right hepatic duct. This is tonification point of the gallbladder meridian. GB43. Okay. And right side cystic duct. GB42. Gallbladder left hepatic duct. A deficiency on GB42 left or right indicates a cholangitis. It's a inflammation, swelling of the ducts of gallbladder. GB42 left right. In chronic cases, there will be deficiency on liver, left and right also. In case there is very much deficiency at GB42, left and right and liver, it indicates a biliary cirrhosis. Yes. Biliary cirrhosis of the liver. We have seen that already. And SI3 point. GB42, if there is very much difference, GB42 and SI3 right side. It indicates an affection of the gallbladder bile duct with the irritation of the whiter scapula. This is a tonification point, especially treated during RRE time. Which is the RRE time of the gallbladder? See here, it is mentioned 11 p.m. to 1 a.m. 11 a.m. to 1 p.m. Morning and night time. Whole cystitis, treat GB42 right side, SI3 right, and GB42 left. Wonderful protocol this is for cystitis or polycystatic attacks or hyperacidity attacks. or gallbladder stones. It's a wonderful protocol. Gallbladder stones are also treatable. Even I have treated almost 8, 9, 10 mm of stones of gallbladder with the help of using these gallbladder points and some additional points. GB41, right and left. Yeah, according to TCM, this GB41 point is very useful for sciatic pain, any kind of sciatica. Here it is used for balancing the gallbladder. If it is excess acid or excess bile is secreted or less indigestion or constipation happens, GB41. GB40 organ source point, you know, the source point of liver, GB40. This is useful for disturbed sleep. GB40 point is very much useful for disturbed sleep. If somebody is getting disturbance in sleeping because of the thoughts or stress, or dream disturb sleep, because its pathway more is on the brain, no? So related to that, GB40 very useful because it's a source point. You have to use it for disturbed sleep. GB39A, then GB39 is an influential point for bone marrow. You must have learned it in the same one. This is the influential point for bone marrow, where all the types of RBCs, WBCs, everything, platelet, everything is produced. Yes, RBCs. Then GB34, SMP for muscles. Yes, we know. It's the influential point for muscles, gallbladder 34. Muscles and tendons in all over the body. Then GB33 is the SMP joint of a lower extremity. Okay, it's a pathway. 33, it's above knee actually, just a posterior part of the knee. It's it is the lateral end of the popliteal crease. Medial end of the popliteal crease is liver 8. We have seen that. It's the lateral end, outer end of the popliteal crease is this GB33. Then GB29, it's the third MP of hip joint. We have seen that hip joint. Then GB25. Yes, this is an important point. You have to remember this. GB25 is the alarm point or the front move point of the kidney meridian. It improves the function of kidney. It's very specific point. Gallbladder 25. Because kidney is again related. There is one axis, you know, kidney, heart, and brain. These are the energy wise. If you see, it is in the one axis. Kidney, heart, and brain is in one axis. If somebody's heart is failing, its kidney is also failing, its brain is also failing. If kidney is failing, its heart is also failing. In the functions, it's because of the energy connection. The brain is also. So brain is dying, the heart is dying, kidney is dying. It's in one axis. While in the formation of these all the meridians in the womb of the mother, when fetus goes inside the it's a development of the fetus occurs inside the womb of the mother. Then in the womb, from the cell division from 2 to 4 to 8 to 16 to 32, the cells are divisioning, and there one axis forms first. In that axis, the brain, the heart, and the kidney, because kidney energy comes from the heredity, from the mother and father, and their mother and father, and their mother and father. From the, it comes from so many generations. Kidney energy. So kidney, heart, and brain, it's in one axis. So this gallbladder is more related to brain. So that's why this kidneys functions point is also there in the. That's why this is the alarm point. GB25. Then GB24 is the alarm point for gallbladder itself. Yeah, to improve the function, we have to tone this point. GB25. GB23, additional alarm point for the gallbladder. The GB21 anterior lobe of pituitary gland. So this is the controller gland, pituitary gland, for all the different glands in the body. So we have to use triple warmer 16, SI 15 along with this GB21. Its main point is here only. The highest portion of this trapezius muscle. You can see here the highest portion of this trapezius muscle. The topmost portion of this trapezius muscle is GB21 number 1. So even if you will press this on both sides, you will feel much better. The pain is there, but much better because it is also called as a detoxification point according to this. It detoxifies the body. So GB21, just below that there is a triple warmer 16, and just near to that there is a small intestine 15. These all points are very near to each other. That's why these all are working on the anterior pituitary lobe. Now GB20A, intermediate lobe of pituitary gland. We know this pituitary gland for pituitary gland we are treating this triple warmer 3 also, triple warmer 3 and 5. This point is important in the disturbance of the pigmentation metabolism. Anywhere pigmentation metabolism. Then GB20, it's a sympathetic nervous system point, SNP. You have to sedate this point, GB20. Because GB20 is the backside of the earlobe. Just mastoid bone is there, just back and the base of this mastoid. There is GB20. For headache, any kind of what, any kind of pain inside the head, GB20 specific. Then GB19, cerebral peduncle, then GB18A, inferior branch of the colliculi. Now these are the diagrams. Just come to the page number 172. Superior branch of the colliculi. GB18 is responsible for visual reflexes and reflexes altered position of the trunk and head and eye. Okay, GB18, then GB17. These are the on this surface. Scalp surface. GB17, again it is related to brain. GB16 is the episomnic center of the diencephalon. It is the sleeping center in diencephalon, is the center to induce sleep. To induce sleep, we have to use this 16. 16 number point original is just above the apex of the ear, 1.5 kun, that is GB8, and above 2 kun, there is GB16. This is very important point. If you will massage this point, patient will feel sleepy. To induce the sleep is very important point. GB16. Original point. You can use magnets also. GB14, again for the vision problems. It's very useful. It comes here. Just a straight away from the this thing, our eye. On the pupil, just see the pupil, just look at the front, just above the pupil, here it comes, just a half inch inside the anterior hairline. This is the location of GB41, and it's very useful for any vision problems. Then GB12, it's the posterior hypophysis of pituitary gland neurohypophysis. GB12, excess urination, we can use this one. Where excess urination happens, this to treat this problem, we have to use the GB12. Because it's related to that part of the pituitary hypophysis. Then GB11, nucleus of the vagus nerve, medial organ. GB11A, medial geniculate body. Then GB11, CMP, center for sleep and awake rhythm. You can see GB11. This point is responsible for falling asleep and awakening in time. Melatonin is manufactured by the pineal gland in the brain and is released at night to regulate the timing of body's sleep and wake rhythm. Okay, but treatment on this point improves the secretion of melatonin. Melatonin level declines with age and virtually disappears by the old age. That's why there is an insomnia problem in the old age. To improve the quality and quantity of the sleep, we have to use this GB11. Very important point, GB11. Then GB10 is nucleus rubor, again, for the skin problem. Then GB10A, GB9. Come to the page number 175. SMP for mesencephalon or midbrain. nuclei of fourth and fifth cranial nerve. It controls the movement of the eyes, head, neck, response to visual stimuli. It controls the mastication. It's GB9, very useful. Then GB8, again it's 1.5 on above the apex of the ear. Medulla, local swelling in the related part, gray matter of the brain and muscles system tells about the degeneration process. Yeah, if pain is there, it indicates the degeneration of in the body, any organ degeneration. So this is the center of the degenerative process. Message about the degeneration process in the body comes from this point, and this is also the best point to stop and treat degeneration processes all over the body. Any kind of degeneration happen in the body, use this GB8 point along with GB23 1A, which is the CNP for the organ degeneration of the entire body. Okay. Then GB4, next page 176. That it's thalamic related. So thalamic syndrome, deficiency in bone cartilage and in coordinated movements, it is very useful for the thalamus. So what is the use of function of thalamus? Impairment of all types of sensitivities, sensory functions. Then hemiplegia or hemiparesis, then severe spontaneous pain. That time we have to use this GB4. Then GB3 is the cranial nerve point, trigeminal nerve. So first branch of trigeminal nerve, ophthalmic branch. Here it comes, GB3. Then come to the page number 178, GB1A, especially used for eye, so it's near to this. And 1-1, GB1-1 for the eye. Again, it is the SMP for optic nerve because it's very near to that. And GB1, it's a PSMP for the posterior section of the eyes. Any eye complaint, these 3 points are very important. GB1, then 1-1 and 1A. Any visual problem or eye problem. Okay, so this ends our gallbladder meridian. You can read it out. If any difficulty, you can ask me in next lecture. We'll cover up all these remaining 4: kidney meridian, then urinary bladder, then construction vessel and governing vessel. All in the tomorrow's lecture, last lecture. Okay, so it's almost 5 o'clock. GB11, sedate or tone for good sleep. For good sleep, we have to sedate. Sedate the point. Okay, thank you very much, all of you. We'll meet tomorrow in the next class.